Hey everyone, Dr. Phil Page here, back with another exciting topic by popular demand. We received tons of requests to break down Kinesio Taping, and guess what? We're diving right in. Kinesio Taping has taken the world by storm, from professional athletes to weekend warriors. Everyone seems to be trying it out. It's not just a trend, it's a revolution in sports medicine and rehabilitation. But what is it about this colorful tape that has everyone so intrigued? Is it the vibrant colors, the promise of pain relief, or the enhanced performance? Kinesio Tape isn't your average athletic tape. Unlike traditional athletic tape, which is often rigid and restrictive, Kinesio Tape is flexible and dynamic. It's designed to provide support and stability without restricting your range of motion. This means you can move freely while still getting the benefits of support and pain relief. Imagine this: a thin, stretchy tape that can help alleviate pain, reduce swelling, and even improve your athletic performance. Sounds pretty amazing, right? But how does it work? In this comprehensive guide, we'll unravel the mysteries of Kinesio Taping. We'll explain the science behind it, how it interacts with your body's natural healing processes, and why it's so effective. We'll take you through the application and removal process step by step, explore its many uses from injury prevention to recovery, and even performance enhancement. And of course, we'll discuss important precautions and contraindications. It's crucial to know when and how to use Kinesio Tape safely to avoid any potential issues. Get ready to become a Kinesio Taping pro. Whether you're an athlete, a coach, or just someone looking to manage pain better, this guide is for you. Let's get started. Applying Kinesio Tape might seem intimidating at first, but trust me, it's easier than you think. With a little practice and the right steps, you'll be able to do it confidently and effectively. Just follow these simple steps, and you'll be taping like a pro in no time. Whether you're an athlete, dealing with an injury, or just looking for some extra support, Kinesio Tape can be a game changer. Step 1. Prep your skin. Before you even think about grabbing that roll of tape, make sure your skin is clean, dry, and free of any lotions or oils. This is crucial because any residue can prevent the tape from sticking properly. This will ensure that the tape adheres properly and stays put. A good clean surface is the foundation of effective taping. Step 2. Measure twice, cut once. Accurate measurement is key to successful Kinesio Taping. Take your time to measure the area you want to tape. Measure the area you want to tape with the tape unstretched. This helps in getting the right length and ensures that the tape will cover the necessary area without being too tight or too loose. Then, round off the edges of the tape with scissors to prevent it from snagging on your clothes. Rounded edges also help the tape to stay on longer and reduce the chances of peeling. Step 3. Apply with confidence. Peel back the backing paper and carefully apply the tape to your skin, following the natural contours of your body. This step is all about precision and confidence. Remember to apply the tape with gentle tension, but don't overstretch it. Overstretching can cause discomfort and reduce the effectiveness of the tape. Step 4. Activate the adhesive. Once the tape is in place, gently rub the tape to activate the heat-sensitive adhesive. This step is often overlooked but is essential for ensuring the tape stays in place. This will ensure a secure hold and prevent it from peeling off easily. By following these steps, you can make the most out of your Kinesio Tape and enjoy its benefits for longer periods. Removing Kinesio Tape is just as important as applying it correctly. Here's how to do it without irritating your skin. Step 1. Be gentle. Avoid ripping the tape off like a bandage. Instead, gently peel it back on itself, following the direction of hair growth to minimize discomfort. Step 2. Support your skin. If you feel any resistance, use one hand to support your skin while gently peeling the tape with the other. This will help prevent skin irritation and discomfort. Step 3. Soapy solution, optional. If you're having trouble removing the tape, try soaking the area in warm, soapy water for a few minutes to loosen the adhesive. Step 4. Moisturize. After removing the tape, apply a gentle moisturizer to the area to rehydrate your skin and prevent dryness. Kinesio Tape isn't just a colorful fashion statement, it offers a wide range of therapeutic benefits. Let's explore some of its most popular uses. 1. Pain relief. Kinesio Tape can help alleviate pain by lifting the skin and reducing pressure on underlying muscles and nerves. This can be particularly helpful for conditions like back pain, knee pain, and carpal tunnel syndrome. 2. Swelling reduction. The unique elasticity of Kinesio Tape can help improve lymphatic drainage, which in turn can reduce swelling and inflammation. This can be beneficial for injuries like ankle sprains and plantar fasciitis. 3. Improved performance. By providing support and stability to muscles and joints, Kinesio Tape can enhance athletic performance and prevent injuries. Many athletes use it to improve their form and reduce the risk of strains and sprains. Section 5. When to be cautious, precautions with Kinesio Tape. While generally safe, there are a few precautions to keep in mind when using Kinesio Tape. This versatile tool can be incredibly beneficial, but only if used correctly and safely. First, allergies. If you have sensitive skin or are allergic to adhesives, it's essential to test the tape on a small area of skin before applying it to a larger area. This simple step can help you avoid potential skin reactions, such as redness, itching, or even blistering. Second, open wounds. Avoid applying Kinesio Tape directly over open wounds, as this can increase the risk of infection. Instead, apply the tape around the wound to provide support without compromising the healing process. Third, pregnancy. If you're pregnant, consult with your doctor before using Kinesio Tape, as it may not be suitable for all stages of pregnancy. Your healthcare provider can offer guidance on whether it's safe for you and how to use it effectively. And finally, seek professional advice. It's always a good idea to consult with a healthcare professional, such as a physical therapist or athletic trainer, to determine the best taping technique for your specific needs. They can provide personalized advice and ensure that you're using the tape in a way that maximizes its benefits while minimizing any potential risks. Remember, Kinesio Tape is a powerful tool when used correctly. By following these precautions and seeking professional guidance, you can make the most of its benefits and support your body's healing and performance. Section 6. Kinesio Tape is not for everyone. Contraindications. While Kinesio Tape is generally safe for most people, there are a few contraindications to be aware of. First, deep vein thrombosis, or DVT. If you have a history of DVT or are at risk for blood clots, avoid using Kinesio Tape as it can potentially worsen the condition. Second, active infections. Do not apply Kinesio Tape to areas with active infections, as this can trap bacteria and worsen the infection. Third, skin conditions. If you have any skin conditions like eczema or psoriasis, consult with your doctor before using Kinesio Tape, as it may irritate sensitive skin. And finally, cancer. If you have cancer or are undergoing cancer treatment, consult with your oncologist before using Kinesio Tape, as it may interfere with treatment. Section 7. Kinesio Tape. Fact or fiction? With so much buzz surrounding Kinesio Tape, it's only natural to wonder if it lives up to the hype. While more research is needed to fully understand its mechanisms of action, numerous studies suggest that Kinesio Taping can be an effective adjunct therapy for various musculoskeletal conditions. For instance, a study published in the Journal of Orthopedic and Sports Physical Therapy found that Kinesio Taping, when combined with exercise, can improve pain and function in individuals with knee osteoarthritis. Section 8. Your turn. Join the Kinesio conversation. Have you tried Kinesio Taping? What are your thoughts? Share your experiences, questions, and tips in the comments below. Let's create a supportive community where we can learn from each other and explore the fascinating world of Kinesio Taping together. Section 9. Thank you for joining the Fax Academy. Thanks for tuning in to another episode of Fax Academy 0122. We hope you found this deep dive into the world of Kinesio Taping informative and engaging. Don't forget to give this video a big thumbs up, share it with your friends, and subscribe to our channel for more evidence-based health and wellness content. Until next time, stay curious.